Everyone. Thank you for joining us today for our webinar. We're going to go ahead and get started. I just wanted to go ahead and remind everyone the call-in information. If you're having any technical difficulties, please go ahead and use the chat function, and you can message me, Global Genes, or the host. If you are having trouble utilizing the WebEx, please email me at ashleY@globalgenes.org. I'll be checking my email to help with any technical issues. So with that, I'm going to go ahead and pass this off to Danny to get us started.
Actually, I want to welcome all of you to this Global Genes webinar on keys to effectively communicate with healthcare providers. Daniel Levine, principal of Levine Media Group and host of Global Genes Rarecast, and it's my pleasure to be moderating today's panel. We've got two great panelists today who will share their perspectives and insights on effective communication with doctors and other healthcare providers. Our panelists today are Jody Vento, manager of the Brain Care Institute and Center for Rare Disease Therapy, and Gil Moore, senior manager of patient advocacy for Horizon Pharma, who can speak today as both a caregiver and rare disease patient. Thanks for joining us. I'd also like to thank our sponsor, Sanofi Genzyme, and for its support for today's webinar, and the staff of Global Genes and Ashley Yee for her great work putting together and coordinating today's program. The webinar is meant to be interactive. I encourage people watching this live to use the instant messenger in the bottom right-hand corner of their screens to send questions for the panel as we go. I'll do my best to work these questions into our conversation, while I'll try to save some time at the end for questions from the audience. Today we're discussing keys to effectively communicate with healthcare providers. Rare disease patients often face complicated issues they must address in limited time windows with physicians. They also often get care from a variety of specialists who may not be in touch with each other or aware of what each is doing. For discussion, we've asked Jody and Gail to each begin with a presentation. With that, let me turn it over to Jody Vento, manager of the Brain Care Institute and Center for Rare Disease Therapy. Jody?
Hi, good morning and good afternoon, everybody. Thank you very much for inviting me to speak today. I'm a genetic counselor by training, and as Danny mentioned, I'm also the manager of the Brain Care Institute and Center for Rare Disease Therapy at the Children's Hospital of Pittsburgh. And so I speak to you today based on my experience of working with a number of families and patients over my career and seeing some things that have worked well and some things that we've learned from on how to effectively communicate with your healthcare provider. Okay, so first, why is this so complicated? Well, I think your relationship with your healthcare provider is much like a lot of relationships in your life, and they take work, and sometimes relationship with a communication takes some back and forth to get it right. But I think there are some things in the healthcare field that make communication a little bit more challenging. And one of the really important things to remember is that ineffective communication is one of the leading causes of medical errors and patient harm. So it's really, really important. It's really important within the care field and between healthcare providers and their patients. One of the reasons it's really complicated, and perhaps this is obvious, but professionals from a variety of disciplines are all providing care at different times of the day, and they're often dispersed over different locations. So even within our own hospital, some of our doctors and nurses aren't even in the same location for the majority of the day, may not work the same shifts. So just casual bump into somebody, have conversation about a patient isn't always built into everybody's day. And so you have to find new and different ways to communicate. Additionally, each specialist might have a different priority. So, for example, a neurologist may be very focused on controlling one's seizures, and a gastroenterologist may be very focused on caloric intake, for example. So aligning those goals with what the patient's goals are is really important. Then everybody has differences in how they're trained and what their preferred communication styles are, and I think this makes it challenging for folks that are in the patient or the parent or family member perspective to try to find the sweet spot of the best way to communicate with various healthcare providers. And another big barrier is time, and perhaps that's obvious too, but it is getting harder and harder for healthcare providers to have built time through their day to allow for extra communication outside of appointments. But this is what we're all trained to do in healthcare, and most hospitals, most doctors' offices strive to provide patient-centered care. And I think this is really important to remember, because this is what doctors want, this is what hospitals want, and I think this is what patients want too. But there's some key concepts of patient-centered care that are important to keep in mind, because I think they're really central to good communication. In respect on both sides, information sharing, and I should say timely information sharing, because I think that part is really important too. Active participation, coordination and communication, and then patient support and empowerment. One of the things I always recommend to patients and families is to define your goals of care. Now, this is just an example, and these are things that are likely to change over time. But everybody should have their own goals in mind. So this is an example of a patient in August of 2016 that may say, my most important goals for my child are to reduce the number of daily seizures, to allow him or her to sleep better, and to allow him or her to miss less school. And if you can begin every appointment with every physician addressing what key goals are, it will help your doctors provide that care to you. And these goals change over time, and they may be things like, relieve pain or other things. But the more specific you can make your goals, the better. And the more you can communicate them, the better. And so as a genetic counselor, one of the things that we try to do at the beginning of every visit with a patient is what we call contracting. And so we have a discussion and say, these items that we plan to go over today, what are your goals? And not everybody always opens that window for you, but I think that when you begin a visit and your doctor asks you what brings you in today, you can start by naming what some of your goals are. General guidelines for preventing medical errors. The first is to get organized. So any patient or family that I've worked with has heard this from me before. And so what I used to say 5-10 years ago about always being sure that you have an updated binder has changed a little bit over time with technology. Now there are apps and electronic ways that you can store medical records, but the idea is to have some way to keep a copy of your own medical records or your child's medical records in an organized fashion that is easily accessible. And so, for example, if you have an electronic way to store some of the records, you want to be sure that you can access that easily if you're inside a hospital. And so if you need to have Wi-Fi and other things to access it, that may or may not work for you. So just sort of keep that in mind based on your own preference. I also recommend that everybody writes a short narrative about you or your child's illness, journey, and main medical concerns. Again, this is something that may change slightly over time, but it gets exhausting for patients and families to repeat this information over and over again, and it also leaves room to inadvertently leave something out because you've said the story so many times that it's hard to remember every single detail for every single provider that you meet. And so if you have a short narrative that you can share, extra copies that you can share with your different providers, it helps to ensure that that every provider that you meet with has the same information. And again, define and share your goals of care. And if you're not sure what those goals are, then I think that's a good conversation to have with your healthcare provider too. And then, of course, update. You know, patients that are more involved with their care get better results. And organization, paper or electric, it really is up to your preference. Sometimes I think paper is easier just because you don't run into any issues of trying to access things in different settings. If you're, especially for families or for anybody that has any, physical limitations, carrying a binder might be hard. So I think that whatever method works best for you is good. The idea is just to have access to these sorts of information. And so for families that I've helped make a binder, these are the tabs that I've recommended that one includes. If you have a diagnosis that requires any sort of emergency protocol, you always want to have a copy of that protocol letter, certainly in your binder, but also in your wallet or some other place that would be easily accessible should anybody need it in an emergent setting. Up-to-date copy of all medications and allergies. Also a copy of your active providers and potentially your past providers, a specialist that you saw one time, that sort of thing. I think that's really important to have and to share. I just want the doctor's name. You also want the doctor's address, fax number. And the reason that that's really important is because every single doctor that you see should document in some way, shape, or form their clinic or their consultation with you. And most doctors have easy ways to share that information just by CCing different providers. And so if you have a provider list of folks that you want to be kept in the loop and the best way to send that information to them, and you can provide that to your doctor up front, then that's very helpful. Of course, goals of care, your narrative, growth curves, if that's relevant to your child's diagnosis or condition, specialist consultation notes, imaging reports. If there's a really key MRI finding, if you can have a copy of the CD of the MRI, it would be really helpful in case a different provider wanted to see the images, to view him or herself. Copies of lab reports, and then up-to-date PT, OT, or speech evaluations if you have them. If you have it, an IEP or a 504 plan, the most up-to-date one, and then some paper in order to take notes. And it's really important to create a good team. And this is easier said than done, and it may take some trial and error, but it'll make a really big difference. And you want to be sure that someone, such as a primary doctor, a pediatrician, a complex care pediatrician, is responsible for being the quarterback. And I think Gail will probably say something similar. But who this quarterback is really kind of depends on your child's diagnosis, but it's really important to identify the one person that can sort of be central to the communication with all of the other providers. Don't be afraid to seek another opinion if you feel as though you're not getting the care from a doctor that you're working with. But more is not always better. I've seen a lot of cases where there's just too many cooks in the kitchen. There's just too many doctors involved, too many second, third, fourth, sixth opinions for anybody to really know what their role is. And sometimes it just really complicates things for the patient. And so finding the sweet spot of a good team that you can trust is really important. So make appointments well in advance. This may be obvious, but some specialists book 6 months, a year out. And so the sooner you can make appointments and follow-up appointments, the better. And then this is really key, but ask your doctors to communicate with one another. Sometimes patients have to sort of be in the middle of the communication, but they really shouldn't be, because I think it really lends itself to mistakes, to things that just aren't communicated clearly. And so all doctors, their clinic notes. So ask them at minimum, to communicate with your other doctors in that way. Sometimes it may require a phone call, and I've found that in my experience, most doctors, if you ask them to do this, are really, really, really more than willing to do so. Outpatient appointments, come prepared. Leave extra time, come early, but be prepared to wait. This is just one of the difficulties of seeing specialists, that you may be waiting a long time for appointments. If you have snacks or drinks or supplies or a book or something to keep yourself or your kids occupied, it just helps make the day smoother. And just have everything that you need, go over everything you need in advance so you have it with you, because the more prepared you are, the easier and more productive the appointment will be. Sometimes it can be helpful to bring another person with you, another set of ears, somebody else to take notes, to help process the information that the doctor said, if that's possible. And also think about what your questions are before you go in to see the doctor, and write them down. Sometimes after you park and deal with registration and finally get into the room to see the doctor, you may have forgot some important things that you wanted to go over. And so save the right questions for the right providers. I think this is really important to things being most productive. If there's a question about GI symptoms, be sure to ask the right doctor that, not the neurologist. Even though everybody should be in the loop of all the things that are happening with you or your child, be sure to direct questions to the right provider. And leave the appointment, know the plan, everything before you leave, because once you leave, it's harder to call back and get this information. Now, really important, and this is probably very important to me because I'm a genetic counselor, and if anybody's ever had genetic testing, results take a long time to come back. But if you have a test performed, do not assume that no news is good news. Always know how long it's going to take to have results back, and ask how those results are going to be communicated. Do you need to call and ask what the results are? Will the doctor call you? Will they send you a letter? Just so that you know how that information will be communicated. And if results are expected back in 4 weeks and you don't hear, then call and follow up. A number of errors happen when someone assumes that they didn't hear anything, so the results must have been normal. And in the hospital, so in the inpatient setting, there's some different nuances that come up. One is you may see doctors that aren't your primary doctors, and so there's going to be a lot of people that are coming in and out, and may have to repeat your story a million times. And so this is where a narrative can help. And it's also really important that you feel empowered to ask every person that comes into the room who they are and what their role is. Most people should introduce themselves, but sometimes in a busy hospital setting, this goes by the wayside. And it's really important that you know who they are and why they're there. And try to be present if you can for morning or afternoon rounds. Most hospitals try to do patient-centered rounds where they can include families and patients in the conversation. And so it would be helpful if you're there and able to be present for that. And it's like for outpatient appointments, before you leave, make sure you know what the plan is. If you have a new onset of an acute symptom, a GI symptom or a neurologic symptom, then you may not have an outpatient neurologist, for example, established yet. And so what do you do when you leave the hospital if you have questions? Who is the right person to direct those questions to? Those are important things to ask before you leave. Just tips, and this is a bit on the pediatric side, but in many pediatric hospitals, we have child life professionals that not everybody knows about, but they're wonderful. And they're trained professionals that can help children and their families overcome a lot of health-related challenges and really issues with communication. They can help with medical play, anticipatory guidance, and it's a wonderful service that sometimes you have to ask for, but that can be really helpful. Also, a lot of hospitals will do tours, which can just be helpful in reducing anxiety if you have a planned procedure. And there are pediatricians in some centers who specialize in children with special or complex needs. Sometimes they're called, complex pediatricians or DRG pediatricians. There's all different names for them, but look into it if you have a child that has complex issues, because you're still going to need a primary care provider that can help with things like ear infections, strep throat, but some folks that do specialize in kids with complicated issues. And don't talk for the doctors. Like I said, make the doctors talk to each other. This is really, really, really important. To help and advice and alternative approaches, and stand your ground and trust your intuition. Those things may sound obvious, but they're really important. And ensure doctors have all information, because just because you said it to one person doesn't mean that they communicated it to everybody else, or that it's documented in the medical record in a way that's easily accessible to everybody else. Ask each provider what their preferred means of communication is. I know me personally, I prefer email for quick questions, but when it's a complicated issue, I'd really rather talk over the phone or at an in-person appointment. But for quick questions, I like email, but not all doctors are on email or feel comfortable communicating that way. And ask what to do for urgent concerns. And don't leave requests, especially routine requests, to the last minute, like prescription refills. And another piece of advice I have is to be grateful. And this may sound like a small thing, but working in the healthcare field for some time, it feels really good to have somebody say, thank you so much, or I appreciate what you've done. I once had a patient, and this was probably 8 years ago now, and it's just stuck in my head, that sent a card, like a photo card, to all of the different healthcare providers that worked with her and her daughter. And on the card it said, "It takes a village to raise a child, and thank you for being a part of our village." And it's still on my desk. It's still so meaningful to me, and it's really rang true. And so, taking time to say thank you, I think, means a lot to the healthcare providers, and can go a long way. When describing your symptoms or concerns, be specific. So I see this a lot, especially with kids, where a parent may say, he's just not himself. Well, what's different? Has he vomited? Does he have pain? Where's the pain at? Can you give the pain a level? It's harder for doctors to address things that are vague and exaggerate no matter what. I think this is really important, because you want to be really sure that the doctors trust the information that you're providing to them. From childhood to adolescence. Again, this is a little bit more centered in the pediatric setting, but start young. And if your child is able to, let him or her speak for themselves, to describe their pain or describe what their concerns are or their goals. Good communication is important, and a lot of times errors happen in that transition from pediatric to adult providers. So the more you can empower a child to be a part of their medical care earlier, the better. Much about insurance companies other than to stand your ground and don't give up. Most insurance companies aren't going to advertise amazing services or coverage that they have. So you may need to talk to your doctors or therapists or other parents to see what they're able to get covered by their insurance company to learn some tips and tricks. You might be surprised about some of the things that they will cover. And lastly, other patients and parents are often the best sources of information. just being involved with a group like Global Genes, I think really helps you connect with those sort of folks. Doctors, one of the most effective things I've seen is families that really sort of guide their providers on best communication style, and doctors really do learn from that. Share your successes and challenges, and stay involved with support and advocacy groups. And there's some references.
Great, Jody.
Sure.
I want to remind our audience that they can instant message questions they may have for our panelists, and we'll try to work them into our conversation as best we can. You talk about the need for a quarterback, someone on your care team who can take charge and coordinate the other members. Is there an obvious choice? Who should this be? What choices do a patient have?
Yeah, I think it depends a bit on the diagnosis. Sometimes it can be a PCP, but oftentimes PCPs see 25 patients in a day and really not have the bandwidth to do it well. In other cases, it could be a neurologist. I think whoever the quarterback is going to depend most on what your most pressing symptoms are, and if that person has the right personality fit to be able to communicate well among other providers.
And does the patient need to ask the doctor in a formal way to take on this role? Which work is that you're asking the doctor to take on?
Yes, I do think it should be asked formally, just because I think it's really important that everybody knows what their role is in a patient's care, whether it's somebody who's driving things for a number of different specialists or somebody who's just providing a one-time consultation. And so I think it's important to be upfront and explicit. And hopefully it doesn't require that much more work. It just requires a thoughtfulness in communication and ensuring that everybody is in the loop on all of the different specialist visits and plans of care.
You talked about the problem of having too many cooks in the kitchen, each doctor not knowing what the other is doing. The patient be responsible for keeping everyone in the loop, updating doctors when they're seen or disseminating test results as they come in, or should the patient communicate with the quarterback and leave it to the doctor to clue in others as appropriate?
Yes, I think it's a balance of the two of those things, Annie, and I think that patients really need to be educated about all of these items, but really the doctor should primarily communicate with one another. And again, most of the time, if you ask your doctor, can you please let Dr. So-and-so know this plan, they're happy to do so. But you want to know what the plan is too. So I think that you want to be empowered to know, but you really want to encourage the communication between the physicians.
Contact I have with my doctors these days is through email. Is this an effective way to improve communication and get everyone on the same page, or is this something doctors don't like? Is it a matter of individual preference and tailoring your approach to each physician?
I do think it's individual preference, as well as, some hospitals, departments, doctors' offices have certain policies, either for or against email communication. So I think it's a good conversation to have with your doctor. And I really do think email can be helpful in pulling several different folks in on a plan of care. But I think that complex conversations really still need an in-person or phone conversation. And so just sort of trying to be thoughtful about, it's a question about, this isn't working great, do you have a suggestion on an alternative? I think that's a great email question. But if it's a very complex question, then I think those questions are better dealt with not over email.
Well, let's turn to Gail Moore, Senior Manager of Patient Advocacy for Horizon Pharma, who can speak today as both a caregiver and rare disease patient. Gail?
Hi. So pleased to be a part of this today, and I welcome everyone, and good afternoon, good morning, and maybe good evening, because I think there's some folks from the UK. I'm hoping that I can provide both a patient and a parent and a caregiver perspective as our family is affected with a primary immune deficiency. I'm back here and just say this is my opinion and not the position, the opinion of my employer, and everything I share with you today is really coming from my own personal experience. we realized very quickly that, it's really important to be a part of our care. It's a team effort, as Jody mentioned, and it's really important that you identify your team members and you have the ability to speak with them freely. And that communication is really essential between the patient and all of the team members. Foundation of our healthcare system, and trust itself, the patient-healthcare team relationship is so important. A patient has to have confidence in their team, and in our case, building that confidence took time, and it will take time for a good relationship to be built, and it really requires open and honest dialogue between everyone involved. And the better the relationship is, in terms of mutual respect and knowledge and trust, the outcomes. My physician actually grew to trust me, and we would have really detailed conversations about our plans, to get someone involved, when not to. So a part of that is just the time, as Jody mentioned, to build that trust, the ability to listen and participate with communication. So a little bit about how to build that team. I know she mentioned it, but first you do have to identify, as Danny asked Jody about and Jody mentioned, that point person, that quarterback. And it'll be different in every single case. In our personal case, I've designated my immunologist to be our quarterback, and probably the next most valuable player is our primary care physician that works freely between each other. And we also had to determine what that kind of relationship would be like. And I'll mention a few different types of relationships that patients and doctors can have a little bit later on, but you really need to think about that. Figure out what is the relationship you're most comfortable with in communicating with your doctor and in the position as a patient with your doctor. I like to recommend, and my tip would be to build a partnership and more on mutual respect and trust. And I do think you need to request and facilitate coordinated communication. And that's down to even as much as signing that release form when you're in the doctor's office. It's really important that you make it easy for them to communicate. Understand your role and responsibility on the team, and advocate, as Jody mentioned as well. So who would your team members be? And of course it's going to be your physicians and some of your allied healthcare and such, but there's other folks you need to think about too. And even part of that team is the office staff. As you trust with them, I know in our case, when my daughter was very sick early on, I would call and I would get the same receptionist every time, and she began to know me. And that friendliness, even in a time of panic, really helped me get to the doctor that day. We got to build a rapport, and she said, "Oh dear, something's going on with Kinsey. Let me get a hold of his nurse right away." It's going to help things a little bit, so I encourage that. And build relationships with your home health care folks if you have home health care services, well, especially pharmacies, and of course the insurance company. And a little special note about your case manager. Passed this tip on to me a long time ago, and it really was very beneficial, and I'm going to share that with you. That is, those case managers are really involved in your care, and they're coordinating some of the care through the insurance company. Put a face to them. Let them know who you are. Always speak politely to them. Send them a Christmas card with a picture of your family. They're there representing you within the insurance company, and they're your advocates. And really building a relationship with them is very, very important. And of course, as Jody said as well, tell everybody thank you. It's so nice to feel appreciated, and each one of these folks in our team need to feel like they're appreciated for the work that they do. Some of the different types of relationships. And so take a minute here and think about what you're comfortable with. Default relationship is where the patient is more passive and the doctor's passive. You're kind of moving along. There's low control by the physician. There's low participation by the patient. The paternalism type of relationship is really a doctor who says, "Now, I told you you need to do that." Is that a kind of relationship you feel comfortable with or not? then the opposite of that is where the patient really has all the control. I'm paying your bills. I'm coming to see you. You know what I want. And what I recommend and what I think is the best is that equal partnership, that mutuality in the relationship where you exchange ideas and you see this as a joint venture. You're on a journey together. To make you smile there, but good communication is essential, and it results in quality outcomes. Breakdown really causes a lot of it could slow care down. It could dissatisfaction and mistrust. So ultimately, that communication is very, very important, and your health depends upon it. So communication tips. I know that Jody shared some, and I'll share some as well. One of the biggest things I learned was how important it is to really understand as much as you're able to about your condition. I asked questions. I learned as much as I could because when they communicated with me about an issue, it gave me that basis to maybe understand it a little bit better. I learned to use the I statements, I don't understand, rather than you're not being clear. That puts people on a defensive or kind of puts the relationship in a different way. Help you, and that's the key I want to share there. And Jody hit on it as well. Don't be afraid to ask for more information. Don't be afraid to say, I don't understand that. Could you explain it to me in another way? And another way is maybe to paraphrase. After you hear something, repeat it back. Say, so you mean I should take them 3 times a day at these given times, or so you know I should go have this test, and then it'll be followed by this test. Help you understand by paraphrasing back to them your needs. I can't say enough about keeping a health diary. Back to my own situation, myself as a patient, and my daughter's a patient, my mother was a patient. My son also had a lot of health issues. And he wasn't quite as sick as the rest of us, but sick enough. And I didn't realize it until I actually sat down and started keeping a diary. And when I kept that diary, when I went to the doctor's office, I was literally in my diary wrote, in particular with him, he had this infection, it was treated this long with this antibiotic. And I literally wrote down. Well, I realized over a 7-year period of time, my child had 56 sinus infections. And really, even though we were seeing specialists and we were all communicating and they were testing them, until they really saw that in writing, that it made them go, okay, this is not a quality of life this young should have. And he began treatment, and now he's doing great. But as somebody who was involved in so much care, in this particular case, that diary really came to help demonstrate to the doctors just how our quality of life was being affected by his constant infection. So a little bit about your role with the doctor relationship. It's really important to respect the doctor's time, as Jody mentioned it earlier, and be focused on during your appointment. Come in, but don't overwhelm. Don't have 50 pages from the internet. Figure out what the most key point is that you want to share in that particular appointment, or 2 points or 3 points, but don't come in just flowing through information, because really it'll get lost along the way. Provide accurate and complete information, and as Jody mentioned, having something written down ahead of time that you can share with if it's a new doctor, the history, if it's your see regularly, if you will, put what you're there that day and what information you want to convey to him, symptoms, everything you can possibly think of, as Jody mentioned. Prepare to listen. Sometimes it's really important to listen, and also always try to have an attitude of non-adverse correlation. Can't speak today. Basically be gracious, be understanding that they're trying to figure this out, and maybe it's going to take a few minutes to hear what you're having to say, and then also some time for them to think. Always positive, and encourage encourage and facilitate your team's community. Again, I want to reinforce, sign all the proper paperwork. It would important that they're able to send the test results they need or have access to medical records at other locations. And also, leaving your appointment, understand your treatment plan and paraphrase if you need to make sure you're understanding exactly what they want you to do and any follow-up that's requested. So what's your team's role? Well, a good team will be accessible and reliable. They're going to have a willingness to help. They're going to be open to your information when you bring it and have the expert knowledge or access to resources to consult or refer you to. They're going to take the time to listen. They're going to take time to teach and explain. And that's so important that you give them the time to teach you and explain to you about your condition. And they should provide an understandable treatment plan or protocol. And to my particular situation, we had actually a protocol that was very helpful. My daughter would have a fever over 101. I had steps of what I needed to do. I knew if she got exposed to chickenpox, I knew what to do. So if you can sit down ahead of time and try to think of what are all of the situations that you need to have an understanding of, and maybe tackle 2 or 3 of them at a time, or if your physician has the time or your medical team has the time to sit down with you and go over those, that you have a protocol on what to do in those different situations. So the best, and I know I'm touching on these a little bit again, that as Jody did, identify your goals, write your questions, take a friend, take someone to take notes for you. If you have the ability to take the notes and ask the questions or be examined at the same time, it's always good to have a friend along. And even if you both write down notes, sometimes one person will pick up something the other missed, and make sure that those detailed as possible. Create a health diary or journal, so important. And if possible, complete paperwork prior to your appointment. So when you get there, you can hand those into the receptionist and be seen as soon as possible. Your appointment, be mindful of the doctor's time. That's important. Time is an issue. Be concise and clear in your communications. Remember the goals that you set beforehand for your visit, and share your list. Pick 5, 10 questions that you're going to ask that are the most important ones, and have those written down, because we get pulled different directions. Sometimes we forget the things that are most important that we go in there for. Again, be sure to understand any follow-up that's requested. So these are questions, and you're going to have the presentation that you might want to consider asking in regards to your appointment that I shared there with you. After your appointment, well, be vigilant. Follow your doctor's orders. We often be guilty of not following orders, and so this is a time that you can build trust with your physician by just following his treatment plan, and then coming back and reporting to him at the next visit exactly how that following those plans helped or didn't help. If any follow-up appointments is required, review your notes while they're fresh in your mind. Sometimes just reviewing them will trigger something that was said that you missed that you might want to also note. Communicate any treatment plan changes or other pertinent information to your healthcare team. If you see another physician and there's some sort of a change, it's good to share that information as soon as possible with the team that originally set up the plan. And of course, report any issues your healthcare team to your team leader or prescribing physician. So that, I'm going to turn it back over to Danny.
Gail, I've got to have the mute button on. You bring the perspective of both a caregiver and patient from a communications point of view. Is there different in those roles? Are you more clear thinking or a better advocate in one than the other?
Yes, I'm much better at taking care of others rather than myself, and I think we're all really guilty of that at times. So it's an important thing to remember. If you don't have a condition, we need to take care of ourselves and follow our own doctor's orders as well as we do for our children or others we're caring for. I communicate better with that physician, with the pediatrician, than I probably do with my own physician, because I'm more focused on making sure that my children have the best outcomes possible. And with myself, I really have to take the time and remind myself to be as clear and organized with the children.
Some people get care in a highly integrated system that lends itself to fostering communication between doctors. You know, my doctors are at Kaiser, they're all on a shared electronic health record. If I send email to one, they're automatically copied. Is your experience is more typical of a rare disease patient? You're getting care from the specialists you may be seeing, and are they connected in any kind of a formal way? And if not, do you work around that?
Not connected, and do reach out to each other occasionally, but if there's a special event or a crisis of some sort, the way if I work around it is by making sure that I have a discharge letter from every visit that I actually take to the next physician or the next part of the team, or share with the team so that they're up to speed on what each other are doing. And then if I can facilitate any communication between them, I try to do that. Whether it's letting one physician know that so-and-so is going to make a change here, or I need to work with physical therapy on this case, and this are their recommendations, and I just pass that information back and forth in case they don't have the opportunity to call late.
The need to understand your role and responsibility on the team. I think as people think of their teams, they may leave themselves off. What would you say those responsibilities are?
Yourself, first and foremost, as well as being a voice and sharing information. Sometimes the tough information is hard to share, or maybe even embarrassing. I think it's really important that you do that. I think your responsibility is, again, to be on time, to be follow your treatment orders, but I know there's many different things that we should all be doing in reference to our physician. If we can just put ourselves in place of what kind of information do they need to know, what is going to make their treatment of us more effective and better and enhance our outcomes.
You talk about the team members in a very broad way, beyond just doctors. Included on your list is insurance case managers, which I thought was interesting. I wonder if you could, again, why should patients think of insurance case managers as part of their team, and what role they have?
Well, especially in more significant rare diseases that are very high cost treatments, a lot of times a case manager is assigned to oversee the case, or if there's a lot of different specialties involved. And that person, is reviewing claims, if you're on some plans, they may be approving extra tests, those types of things. And you really want them to understand what the situation is. And so by having a relationship with them, a positive relationship with them, because it can be frustrating sometimes to work in the insurance system, but having a good relationship with them, they're people who do want to help. They just need to understand it. So as much information as you can share with them, and again, putting a face on your family and your story is very helpful in creating that relationship and hopefully making some of those more difficult things with the insurance company and with approvals and pre-certifications go a little bit smoother.
Let's bring Jody back into this. We've got a number of questions from the audience. The first is, how do you handle mixed messages received from different members of your care team, especially when part of the care team may decide the Western medical tradition like an alternative provider?
So that's a really good question. It actually comes up a lot, very practically, for patients that I work with. And the first thing I will say is it's hey, we actually expect physicians to have different opinions at different times, and I think the first thing you can do is ask for some sort of background on why a particular recommendation is made, so you understand the why behind the recommendation. The other thing I would encourage is just being upfront. So if you say to one doctor, I'm seeing an alternative, provider, and they've recommended X. I think it's really important. We've had patients we have lots of patients that see, alternative providers. And one of the things that has come up sometimes is, they may recommend some supplements or vitamins that are seemingly benign, but that in certain conditions can actually be problematic. And so I think very good communication between providers is helpful. So if you can share, don't be afraid to share alternative therapies with your non-alternative providers, is I guess what I'm saying, just so that everybody is on the same page. And then if there really is a true disagreement between doctors, I would suggest they talk to each other, because I think that can help to alleviate a lot of concerns for the patient. It won't alleviate every problem, but sometimes doctor to doctor, if they can explain why they've recommended one thing over the other, they may be able to come to a better understanding.
Our listener asks about how to respectfully decline a medicine or without being labeled uncooperative with file. I guess this listener has had agreements with the doctor, and he's concerned about being labeled uncooperative, which could affect future relationships. What's this way to disagree with your doctor?
Yeah, I think honesty, and I think if there's a medication that you don't want to take or a recommendation that you don't want to follow, then have an honest discussion about why that is. Is it the side effects? Is it, looking to avoid medications together and seek alternative therapies? What is your motivation? And if you share that to the provider, I think that's viewed very differently than a patient that they send home and make, 5 recommendations, and then the patient comes back and the patient didn't do 3 out of the 5 things. I think that's viewed very differently from the provider. So I think just honesty and rationale can go a long way.
I agree with that. I think that's the best approach in that situation. That the honesty is key, and I think that just further builds that trust with your healthcare provider.
What if things aren't going right when you find communication problems with your doctor? What do you suggest to do to address that? Does this come up in your experience, Gal?
I've been fortunate enough, not to have that situation happen to me personally. I have seen it with some other folks. And, it goes back to sitting down with them, explaining the situation. That's what they did. They sat down, explained their situation, and tried to understand where the breakdown happened and how it can be fixed, just like any other relationship.
And I will second that. And the other thing I will add is many hospitals have departments that are dedicated to these sort of issues. They're sometimes called patient representatives or patient liaisons. I always recommend talking to your provider first if you feel comfortable doing so. I just think that it lends itself to an easier conversation. But if that's not going well, there sometimes are resources. You just may need to ask. And one of the things I've expressed to patients that I've worked with is, that sort of feedback is really helpful, because if something isn't going well or something didn't go well, even if it's after the fact and there's nothing you can do to remedy it, perhaps there's something that you can do moving forward so it doesn't happen to another family. Like I said, teach your doctors. So that feedback is really is really helpful, like speaking as a provider, and I encourage you to sort of get the courage to either share it with your physician, or if you don't feel comfortable, see what other resources are available within your medical system to help facilitate those conversations.
One of our listeners takes that a step further and asks, when you encounter a patient-doctor relationship that's just not working, I suggest they go about firing that doctor and finding a new one.
So that is a little bit more challenging. I think it depends on the scenario. So if it was a one-time consultation with a doctor and it just didn't go right, then sometimes you can just not go back and not further the conversation. But if it's an ongoing care relationship that you really have to more formally end, then I think that you say to the provider, I'm going to transition care to so and so. I think that they're a better fit for myself, my child, my family, and just move forward.
The other audience members ask about the effective way to get your healthcare team knowledgeable on your disease. I guess when you're dealing with a rare disease, even though you may have specialists, you still may have a lot of things that are unfamiliar to a doctor about your own disease. Is there advice you would give on bringing your healthcare team up to speed?
I developed what I call my elevator speech, and I think when, for instance, if we go to an emergency room, a lot of times physicians aren't aware of primary immune deficiency. I know what they do. In fact, I was hospitalized in a small rural hospital in North Carolina, and the doctor literally looked at me and said, I don't even know what to do. I've heard of these, but I'm not sure how they're supposed to be treated, and there are these circumstances. And so, I have my own little 3-minute speech on what it is, and then I ask politely, may I connect you with my immunologist? In that case, that worked very effectively for me. The immunologist got on the phone with the doctor. They knew exactly what to do. I got the treatment I needed, and it was a very, very pleasant experience. So I think, first of all, a whole not overwhelming idea. If you can come up, 5, 7 sentences that gives the gist of what the condition is, so that at least they know that you know what you're talking about, and then offer to connect them to someone that can inform them appropriately.
Question from the audience, and I don't know if either of our panelists are familiar with the issue, but if either of you are familiar with the workings of Medicare, is there such a thing as a case manager? And if not, is there an alternative in the Medicare system when someone would be reaching out to?
I unfortunately don't have a lot of experience with Medicare, primarily working with the pediatric population, so I wouldn't be able to comment on that specifically. I don't know if Gail has any advice. The only other thing I would suggest is potentially talking to other adult patients that may be able to help point you in the direction of something that's worked for them.
I agree with that. I have very little experience in the Medicare system. I know, and there in the Medicaid system are a little bit different. I know in reference to Medicaid, at times there are case managers through their services, but I would, again, suggest reaching out to Medicare directly. I know they do have some different toll-free lines that can maybe provide that information for you, or at least get you headed in the right direction.
We're running out of time here. As a last thought from each of you, what advice would you offer to be more effective in communicating with your healthcare providers? Take this.
Sure. I think that, sort of take it back to where I started, but just like any relationship, I think it takes, and it's more of an art, to figure out the right style, the right frequency, the right, sort of what works right for you and your providers. But I think being patient with it and being diligent is important. And just like Gail said, you'll get there. You just have to find what works best for you and your own personality and your doctor's personality.
I agree. Again, be open, be grateful, be understanding, and also educate. Educate everyone that you possibly can, and yourself.
I'd like to thank our panelists today, Jody Vento, Manager of the Brain Care Institute and Center for Rare Disease Therapy, and Gail Moore, Senior Manager of Patient Advocacy for Horizon Pharma, who is a caregiver and rare disease patient. Jody, thank you both for joining us today. I'd also like to remind the audience, we've had a question about this, that all of our webinars are available for replay on the Global Genes website, and the slides are available for download. I'd like to thank today's sponsor, Sanofi Genzyme, for their support of today's webinar, and the staff of Global Genes and Ashley Yee for her great work putting together and coordinating today's program. Before we go, I want to remind everyone that registration for the Global Genes Rare Patient Advocacy Summit is open until August 15th. If you haven't yet registered, I encourage you to do so. It's a great opportunity to meet, connect, and learn from other members of the rare disease community. Be sure to join us for our next webinar, Transition of Care, Planning for Care for Children with a Rare Disease, which will be held November 22nd. I hope you join me every week for our Rarecast podcast, which you can find on the Global Genes Rare Daily or on SoundCloud, iTunes, or Stitcher. You can continue the conversation with us by following us on Twitter. I'm at @Levine, and Global Genes is @GlobalGenes. As you seek to learn more about rare disease and connect with others, I encourage you to explore the many resources available on the Global Genes website. On behalf of Global Genes, I'm Daniel Levine. Thank you all for joining us today.